So as we're setting up with our next panel, I'd want to at least acknowledge Lisel Loy, who's moderating this panel, who is a member of the roundtable and also Vice President of Programs for the Bipartisan Policy Center, and they'll be addressing the policy considerations.
Thanks, Don. Good afternoon, everyone. I'm Lisel Loy from the Bipartisan Policy Center, and we are closing out this session with a panel on policy considerations. From a policy perspective, this is obviously a very tumultuous time, and we are going to be talking about the issues of obesity reduction against the backdrop of the highly politicized activity around the ACA and the ACHA that's been going down this past week or so. We're very fortunate to be joined, we hope, by two Hill staffers, but perhaps by one, evidence of the tumultuousness, perhaps. So I will introduce Matt and Forecast, who may be joining us, and two other experts who will present their perspectives on these issues. And then, as we've done with prior panels, we will close out with your questions. And here comes Lynn. So first, we will hear from Matt Gallivan, who's the health policy advisor for Senator Bill Cassidy, who happens to be a physician and is a Republican from Louisiana. Matt oversees the senator's health policy work for his Senate Finance and Senate Help committees, and he previously worked for a member of Congress from Minnesota, Congressman Eric Paulson, where he managed his Ways and Means health portfolio as senior legislative assistant. Matt's counterpart, Lynn Shaw, just arrived. Welcome. She joined Senator Tom Carper's healthcare team in 2009 and now serves as the senator's aide with primary responsibility for Medicare, Medicaid, private health insurance, and social services programs. Near and dear to BPC's heart, she also, prior to joining Senator Carper's staff, was a fellow at OMB Watch's Federal Fiscal Policy Program, an NGO focused on improving government transparency, efficiency, and performance. Following their presentations, we will hear from my esteemed colleague, Dr. Anand Parekh, who's BPC's chief medical advisor and provides clinical and public health expertise across our organization, particularly in the areas of aging, prevention, and global health. Anand was at HHS prior to coming to BPC and served as Deputy Assistant Secretary for Health from 2008 to 2015, where he developed and implemented national initiatives focused on prevention, wellness, and care management. And finally, Joe Naglowski is President and CEO of the Obesity Action Coalition, which, as you know, is a nonprofit organization dedicated to elevating and empowering those affected by obesity. Mr. Naglowski has more than 20 years of experience working in patient advocacy, public policy, and education. And as part of his advocacy work, he's dedicated a significant part of his work toward the recognition of weight bias, which I know has been a topic of conversation for this roundtable. So I will turn it over to them, and I will come back to oversee some questions.